Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
So many people that I've talked to always seem to ask the same and similar questions. One, I guess, because it may not be as clear as it should be, and that is, how do you collect properly for a toxic metal urine test? So let me see if I can give you a simple primer how to do that in these just very few minutes. First of all, a single specimen, non-challenged, may not give you many or much information anyway. A single specimen should only be used if you believe someone has had acute toxicity, probably within the last few days. Otherwise, it isn't going to be helpful. Most toxic metals, after a short period of time, some days of one like lead, weeks, goes out into the reservoirs, to whether it's the heart or the ovaries or whether it's the liver or the bones. These metals will congregate there and you will not find them in a simple urine non-challenge test. So let's talk about appropriate challenging and appropriate test. You could do a pre-test and a post-test. Let me explain. Both should be a 6 to 8 hour type of collection. So let's say you would like to do just a plain pre-test, meaning that for the 6 to 8 hours, you're going to have someone collect your urine. So what you do is ask them to go to the bathroom, empty their bladder, and then for the next 6 to 8 hours, collect all their urine, and then follow the directions in the kit to send off a small quantity, which we call an aliquot. What I do, which I believe is the best way to be able to determine what someone's toxic metal possibilities are, is to do what I call a challenge test. Now, for some of you, don't worry, if you do not have a license to write a drug like DMSA or DMPS or EDTA, what I do is I like to use a product called Advanced Zeolite. It's a zeolite actually that I have made for myself, and if you need assistance, I have no problem giving you the person and manufacturer I get it to, since he holds all the intellectual property on the most important zeolite, which is called clinoptilolite. Each one of those tablets are 10 milligrams. So what I do is I have someone go home with 4 capsules, also with the kit, our toxic metal kit. Take the 4 capsules and wait 2 hours. The reason I tell them to wait is because you want that clinoptilolite or the zeolite to get into the bloodstream and have time to do so, to sort of yank in the toxic metals that you want to collect in the urine. So during that 2-hour period, somewhere before you're going to collect, also ask the patient to urinate to empty their bladder. Again, for the next 6 to 8 hours, after that 2-hour hiatus, take the pills, wait 2 hours, empty the bladder, now collect for 6 to 8 hours. And then again, same thing, follow the kit's instructions by mixing it together and pouring off a small quantity aliquot to be sent to the lab. This will be the most accurate way of determining the toxic metals and, of course, the heavy metals, which are the necessary types of minerals that the body requires. I hope this makes it easier for you to understand and how to do this properly. Let me summarize. Spot urine only if you think someone's been acutely poisoned. Want to get a really good idea? Send them home with some sort of chelating agent. I use zeolite most of the time. Give them 40 milligrams. Wait 2 hours. Somewhere before the 2 hours, I ask them to empty their bladder, and then start counting 6 to 8 hours where all urine is collected in one container. At that point, of course, that's when we begin sending to the laboratory our specimen. Hope that helps you. If you have any further question, want to have any further information, feel free to contact me at drmitch@mitchghen.com. Thanks so much for watching.